Chloroquine is sparking some debate. You have Fauci saying, don't put a lot of weight in this. We don't know. You have other people saying that it saved their life. Listen to this. She's a Democrat. She's a local politician, a state representative out of the state of Michigan. Her name is Karen Whitsett.
I really want to say that, you have to give this an opportunity. And for me, it saved my life. And I only can go by what it is that I have gone through and what my story is. And I can't speak for anyone else. If President Trump had not talked about this, it would not be something that's accessible for anyone to be able to get that right now. It would not even be possible. And I mean that honestly, because I did have a difficult time even that day obtaining the medication because of an order that was put down in my state.
And Dr. Oz, I saw you. Oh, sorry, Brian.
Go ahead, Ainsley.
Thanks. I saw you last night, Dr. Oz, talking about that letter from Dr. Wallace. Tell the folks at home, if they missed that interview, who this guy is and his years of experience and what he's seen from this drug.
Let me, if I can, just say one thing about that representative's experience. That's called an anecdote, right? It's one person, one experience. It's important, but it doesn't convince doctors. But I keep seeing that word applied to hydroxychloroquine. That is it's an untrue statement if you think it's only anecdotal data. And I've heard it over and over. There's a case series from France. It published 80 patients. I spoke to that doctor, Didier Raoult, yesterday. It's on my show today. 1,000 patients now he has given this combination of hydroxychloroquine with erythromycin, with 7 patients dying out of 1,000 and 20 going to the ICU. And so he's pretty confident. In fact, he said again, he thinks it's unethical not to use the medication until you get a better idea, a better solution. I also want to point out there was a randomized trial from China. So I would love folks talking about this medication to stop saying it's anecdotal. It is also anecdotal, but there's also more traditional data. We need a bigger trial, no question about it. Dr. Fauci's right. But in the meantime, what are we going to do? Now, with regard to the issue last night, there's a lot of talk. In fact, everyone seems to have become an expert in this medication overnight. I never prescribed it until 2 months ago. And so I'm just learning about it from the rheumatologists. They actually use it all the time on all the lupus patients, 300,000 patients. And Dr. Wallace, who's one of the most prestigious lupus doctors around, Selena Gomez's doctor, for example, she's spoken about it publicly. He's at Cedars-Sinai, the largest practice in the country, led the big societies. He said he and his colleagues in that lupus area are stunned. So they've been using this drug for decades. They don't get EKGs. They don't worry about eye injuries until 10 years of chronic use. They're very clear about the fact that in their guidelines, there are no precautions mentioned because the drug is proven to be so safe. Now, I'm not a specialist in that area, but he sent a letter to the FDA. I urged him to, because when I interviewed him about a related issue, which I'll come to in a second, he said, can I take a second, just warn you about something you guys are all getting wrong? And then I thought about it, and I said, where are the rheumatologists? Where are the people who actually use this every day? We've made a big deal about how dangerous this drug is, and they're saying it's not dangerous. They don't know if it works for COVID-19, but they're saying it's not dangerous. So at least focus on what the real issues are. Now, let me go to this one other topic if I can. I'll post this letter, by the way, on my website. Dr. Wallace is coming on my show today. I'll give it to you, Ainsley, as well, so you guys can post it. Just see what an expert says about this drug. Brian brought up an issue last week. He said, why can't we look at the insurance or medical records of people who have lupus who are on hydroxychloroquine, like Dr. Wallace will be prescribing? Are they getting COVID-19? So because Brian asked for it, I did it. I got Sharecare. They're experts in digital health. They ran a bunch of data. 2.25 million medical records. They found 665 patients who have hydroxychloroquine medications chronically taken because they have lupus. Not one had COVID-19. That doesn't mean much. I'm just going to explain just a small little punch biopsy, but it doesn't point us away from the hypothesis. They also pulled 9 million insurance records. They identified about 14,000 patients who have lupus with hydroxychloroquine. Not one had developed COVID-19. Now, there's many flaws in reporting the data, so I'm going to say it again. This doesn't mean that there's a smoking gun about how we can now use hydroxychloroquine to prevent COVID-19. But what it does mean is I want all the big insurance companies out there, I want all the big hospital systems to work with us. Give us your data. Let's actually see if when we go to more than 1% of the U.S. population, we have something real here. We can use American ingenuity, big data, deep analytics, what we really do well, to try to find out if we could prevent the spread of this virus using hydroxychloroquine, just coincidentally noticing it, as the Chinese have, in our patients.
But it's pretty, I just find it astounding as a layman, knowing that anyone who took this drug for, whether it's rheumatoid arthritis or lupus, whatever they took it for, they don't have the coronavirus, which is pretty astounding, because if half of them did, that would have blown up the whole hypothesis. It is still going strong. And here's a sample of the letter Daniel Wallace wrote to the president, Dr. Daniel Wallace, I should say. Hydroxychloroquine is a very safe drug, he says. It has been given to tens of millions of individuals in the world since its approval in 1955, and as a monotherapy has not been associated with any deaths in the recommended dose. In 42 years of practice, no patient of mine has ever been hospitalized from an HCQ complication. Nearly all my lupus patients have taken zithromycin over the years without a single adverse event. So you could put those things on maybe for insurance purposes to say, look out, eyesight could be an issue or arrhythmia could be an issue. But in reality, that's a doctor that's used it for decades and has no issue with it. So the research goes on, Dr. Oz, and the intrigue grows. Is that safe to say?
It is safe to say, and if I can get these large companies, and by the way, Seema Verma has been fantastic. Medicare is on board. We're getting the insurance from there. We've got large hospital systems wanting to share medical records. The Blue Cross Blue Shield Association. We can get 100 million records to look at. Then we can start to say something meaningful about whether or not there's an alliance here. But we have an opportunity. Let's take advantage of these tips. So, and one last thing, if you're watching this show right now and you happen to have lupus yourself and you're on hydroxychloroquine and you got COVID-19, go to my website, droz.com. Let me know. I want to talk to you. I'm looking for anybody where that has happened. Just one. I want to find out if there's examples of it occurring. Dr. Wallace, who has 800 patients in that category, has none of them with COVID-19. He says his center, Cedars-Sinai in Los Angeles, gargantuan center, 1,000 patients have been admitted over the course of these last few months. And he said there was one patient that got COVID-19, but they weren't taking the hydroxychloroquine regularly. So I'm looking for an example that breaks this rule. I don't want to put too much on it, and I want to be cautious on this, but it is intriguing, and big data might help us.
Wow.
Indeed.
Great work.
All right. So go to the